Hello friends, welcome back to my YouTube channel once again. So today I'm going to discuss the most important topic, which is principles of oral prophylaxis. Okay, this is the one of the most important topic in periodontology because you will get to know what are the principles of oral prophylaxis. Okay, so first we'll be seeing what is prophylaxis. Basically it is a professional preventive dental procedure, okay, which aims of removing the calculus, plaque and the stains from the teeth and to maintain the oral health. Okay, the main objective is to prevent dental caries, gingivitis and periodontal diseases and to promote a healthy oral environment. Okay, so this is about the oral prophylaxis. Now what is defined scaling? What is scaling? Basically it is the process by which plaque and calculus are removed. Okay, plaque and calculus are removed from both supragingival and subgingival tooth surfaces. Okay, what is root planing? So basically root planing is nothing but the where the residual embedded calculus will be present, like near the cementum or something. We will remove that also from the root. Okay, that provides a smooth and hard and clean surface. Okay, so now coming to the principles of oral prophylaxis. So first one will be complete removal of plaque and calculus. Okay, here what we'll do is like we'll remove the complete removal of the uh, calculus as well as the plaque. Okay, dental plaque is the primary etiology factor for the gingivitis and periodontitis. Okay, plaque mainly what it will form, like what it will go is into gingivitis and periodontitis. Okay, we'll remove from both supragingival and subgingival calculus should be removed completely. Okay, so you should not be there any these things. Okay, like calculus, or you should remove completely. Okay, scaling should be done thoroughly without damaging tooth surface or tissues. Okay, you should do the scaling without damaging any tissues or the tooth structure. Okay, next will be prevention of tooth structure. Okay, so instrument should be conservative. Okay, and excessive force must be avoided to prevent loss of enamel or cementum, tooth sensitivity, tooth surface roughness. Only disease deposit should be removed, not sound tooth structure. Okay, you should remove only calculus and plaque. It's not like you will put the force and you will remove some part of the tooth itself. Okay, okay. Next is smoothing of the tooth surface or root planing. Okay, next we will have to see for the smoothing of the root surface. Okay, what is this? After calculus removal, the tooth surface should be smooth and cleaned. Okay, smooth surface prevent reaccumulation of plaque. Okay, if there is a smooth surface, there will be no accumulation of the plaque. Okay, promote reattachment of the gingival tissues and healing. Okay, it will promote the again the gingiva will be growing over there. Okay, and it will form the healing. The next will be proper instrument selection and handling. Okay, use the correct instruments such as scalers, curettage, your ultrasonic scalers. Okay, proper angulation should be there, adaptation should be there of the instrument, control stroke should give it when you are using the instrument. Okay, sharp instrument increase efficiency and reduce tissue trauma. Okay, like if you have a sharp instrument, that will be the best thing. You are going to remove the calculus and plaque in a very easy way. Okay, so next will be the maintenance of asepsis. All the instruments should be sterilized. Okay, you should sterilize the instrument properly. Okay, you should follow the protocol of the sterilization. Okay, operator must follow infection control protocols. Okay, use gloves, mask and protective barriers is mandatory. Okay, in this procedure you have to use mask and protective barrier because the you should not get infected also. Okay, so next will be patient comfort and safety. What is this patient comfort and safety means? Provide procedures should be performed with minimal discomfort. You should not discomfort the patient. Okay, proper patient positioning should be there. Okay, you should know the position of the positioning of the patient and yourself. Okay, so local anesthesia may be used if required. If having a very high sensitivity and where the scaling is must, you should go for the anesthesia if required. Okay, avoid excessive pressure to provide pain and bleeding. Okay, if you give a lot of pressure during the scaling, it will provide pain and discomfort and as well as the bleeding also. Okay, next will be removal of extensive stains. What is this extensive? How it will accumulate? Mainly due to smoking, betel nuts, tea, coffee, food pigmentation. Okay, these are the causes for extensive stains. Okay, polishing help restore natural teeth. and improve aesthetic. Okay. So next is polishing of the tooth. Polishing is done using rubber cap. Okay, polishing paste. Okay, then you will go for the removal of remaining plaque and stains. Okay, leave tissue smooth and glossy, required plaque retention. Okay, next is oral hygiene instructions and motivations. Okay, what patient should be educated. Okay, patient education is must. Okay, instrument included are proper brushing technique, you should tell, uses of interdental aids, mouthwash, brushing techniques, you should tell, motivate for the long term maintenance of the oral health. Okay, next will be periodic recall of the patient. You after prophylaxis is oral prophylaxis not only one time procedure. Okay, it is not a one time procedure. Recall visit are necessary after every 3 to 6 months. You should call and check for the plaque accumulation. Okay, help in early detection of oral diseases and reinforcement of oral hygiene. Okay, next, what is supragingival scaling? How, what are the instruments used here are sickle cell, curettage, and ultrasonic instruments are used. Okay, how you will do is hold the sickle cell or curettage in a modified pen grasp. Okay, establish a firm finger rest. Okay, adapt the blade with angulation less than 90 degree to the surface. The angulation should be less than 90 degree. Okay, cutting edge to the apical margin of the supragingival calculus. Okay, short powerful scaling strokes are activated coronally. Okay, you should give a small strokes. Okay, next is subgingival, usually done by universal or gracie curettage. Okay, how techniques are: curettage is held with modified pen grafts. You should hold it, establish a fix establish like a stable finger rest. Okay, cutting is slightly adapted to the tooth. Okay, then lower shank is kept parallel to the tooth. Okay, this is it is moved towards the tooth. Okay, you have to move towards the tooth. Okay, blade is inserted in under the gingiva and adapt to the base of the pocket by exploring strokes. Okay, you should give a small stroke here. The angulation will be 45 to 90 degree. Okay, apply pressure laterally against the tooth. Okay, you should provide the pressure laterally against the tooth. Okay, this is how. Okay, curettage inserted the face of the blade flushing against the tooth like this. Okay, next, 45 to 90 degree angulation, you have to go inside the pocket and you have to give a small strokes. Okay, then lateral pressure, like lateral pressure to and stroke is activated in the coronal direction. Okay, so what are the viva questions you might get? What is oral prophylaxis? What are the objectives of oral prophylaxis? Okay, then what is a plaque? What is calculus? Types of calculus? Okay, then etiology of the periodontal diseases, then instrument used for oral prophylaxis, then what is root planing, why is polishing done, then what are extrinsic strains, what are intrinsic strains, complications of improper oral prophylaxis, what is oral hygiene instructions, frequency of oral prophylaxis, then contradictions of the scalars. Okay, why asepsis is important in oral prophylaxis. These are the most important viva questions. Okay, define gingivitis, what is primary aim of oral prophylaxis, what is the role of motivation in oral prophylaxis. Okay, so these are the most important questions of the viva. Okay, conclusion, what is the end of this video is like oral prophylaxis is the preventive and therapeutic procedure based on scientific principle aimed at maintaining oral health. Proper removal of deposit, prevention of the tooth structure, patient education, and regular maintenance are essential for the success of the oral prophylaxis. Okay, thank you so much. I hope you liked the video. Do like, share, and subscribe my channel. Thank you.